I'm with Dr. Nicolas Vauthey. He is the chair of the SSAT's program committee. This should be a very exciting week for your association. Now, give us an idea of what's in store.
So it's a very intense program we have for this year and very diverse. We in fact already started yesterday with a conference for residents and fellows which lasted the whole day, where we previewed the program, and I can tell you the abstracts which were presented were excellent, and the meeting is very promising.
I understand there are plenaries also that are going on this week?
There are plenaries, and the meeting will start tomorrow with the presidential plenary, which is the main plenary session. And we'll have our president, Robin MacLeod, who will give her address. It's going to be on Generation Y. And following that, she has a very interesting speaker, Craig Kilberger, who in fact is an innovator in outreach and charitable organizations. And this is one of the highlights of this year for our president, is to promote within the society outreach to our colleagues, and we call it a giving back. And this will probably go on for the next several years for our society.
Wow, and you're not, you're not running away from controversy. I understand discussing the Affordable Care Act. What's the context of that? So
there will be a symposium that's sponsored by by our Education Committee on the Affordable Care Act, and this will be in form of a debate, in fact, and we'll have two debates. One will be the plus and minuses of the ACA for the society and the patient, and the second debate will be the plus and minus of the ACA for the surgeon. So it'll be interesting for our members to come, and in fact there's been a lot of anxiety with the ACA, as you know. It'll be a fact-finding mission, and the debate will be there, and we'll present both sides of the coin.
Well, a meeting like this is designed to find out just what's cost-effective and what's not, and what may play a place in the future of medicine.
It is, and we have as a core of our meeting also a set of a very important clinical ward rounds and debates, which are really purely clinical, and our clinicians love that. They come to these debates, so it's not going to be only the ACA, it's going to be also clinical medicine.
Absolutely.
And we have very interesting debates on whether we should have medical therapy or endoscopic therapy for esophageal cancer, whether or not we should put mesh for the surgeon in some paraesophageal hernia. This is the nitty-gritty of the clinicians every day, and it'll be there.
The questions they ask themselves every day. Thank you so much, Dr. Vauthey. If you'd like to follow DDW's events on the web, please follow our blog, and you can also catch up with us on Twitter. Our hashtag is DDW14.